1 in 10 NHS surgeries are now outsourced to private for-profit hospitals. Private hospitals and their private shareholders are cannibalizing our NHS, sucking it dry of money and staff and creating a two-tier healthcare system in the process. A brand new analysis by the University of Oxford has just shown once again that NHS outsourcing leads to poorer quality services for patients. Ben Goodair, the researcher behind this analysis, had this to say.
In England, between 2013 and 2020, we saw a stark rise in outsourcing to for-profit companies from the NHS. Concerningly, what we found was that this was corresponding with worse quality care. And we found that when there were increases in expenditure on for-profit providers, we saw increases in the number of people dying from medically curable causes. To us, the conclusion was clear. Outsourcing was corresponding with worse quality care across the board. And the direction of travelling was concerning too. With billions of additional pounds being spent on the for-profit sector, we thought this was a really worrying trend. So then, in a review published very recently, what we wanted to know was, is our finding consistent with other healthcare systems and other pieces of evidence looking at the impacts of privatisation on the quality of care? We conducted a review of the evidence, and we did find a largely consistent picture. When healthcare services are transferred from public ownership to private ownership, generally the quality of care worsens. What we looked at was specific moments of change. For example, when public hospitals are taken over by for-profit companies, you often see two things happen. First, you see staffing rates reduced. The number of doctors or nurses per patient declines. And second, you often see the kinds of patients treated changes. For-profit companies will target more profitable patients. In England, hospitals that outsource their cleaning services often saw more infections in those hospitals. There are basically no examples in which further outsourcing is corresponding with better patient outcomes.